I'm going to talk about the stomach and types of things with the stomach then. The stomach is located in the upper abdomen, slightly to the left below the diaphragm. The stomach receives food from the esophagus, and as food reaches the end of the esophagus, it enters the stomach through a muscular veil called the lower esophageal sphincter. The stomach secretes acid and enzymes that digest food. Ridges of muscular tissue called rugae line the stomach. The stomach muscles contract periodically, turning food to enhance digestion. The pyloric sphincter is a muscular veil that opens to allow food to pass from the stomach to the small intestine. The stomach can be divided into 4 regions based on shape and function. 1. The esophagus connects to the stomach at a small region called the cardia. The cardia is a narrow tube-like region that opens up to the wider regions of the stomach. Within the cardia is the lower esophageal sphincter, a band of muscle tissue that contracts to hold food and acid inside of the stomach. 2. The cardia empties into the body of the stomach, which forms the central and largest region of the stomach. And number 3. Superior to the body, dome-shaped region known as a fundus. And 4. Inferior to the body is a funnel-shaped region known as a pylorus. The pylorus connects the stomach to the bundle and contains the pyloric sphincter. The pyloric sphincter controls the flow and partially digested food known as chyme out of the stomach and into the bundle. Inferior to the body is a funnel-shaped region known as a pylorus. The pylorus connects the stomach to the abdomen and contains the pyloric sphincter. The pyloric sphincter controls the flow of partially digested food, known as chyme, out of the stomach and into the duodenum. Stomach bloating, constipation, and abdominal pain can cause problems in the stomach and arms, and it will be hard to eat, poop, and do things you normally would do. And if the organ failure, it will get consequences for the rest of the system. Acute abdominal is not always easy to make a definitive diagnosis of. This also applies to acute illness, injury in the stomach. And then the doctor uses often diagnosed with acute abdomen. So the patient is generally sent to the hospital for further explanation and investigation. The term acute abdomen refers to a sudden severe abdominal pain of unclear etiology. This is less than 24 hours in duration. It is many causes a medical emergency requiring urgent and specific diagnosis. Several causes need surgical treatment. Ulcer is one disease that can affect your organ in different ways. Ulcer is a sore in the mucous membrane, and it is an infection disease. And that was all I have about the stomach.